Hi, this is Sherry Torres, and I'm here with Jackie Stavros and Dr. Elizabeth Warner. Jackie and I wrote a book called Conversations Worth Having, which is all about how to make sure your conversations are supporting your ability to connect with yourself and others and to support your ability to thrive anytime, anywhere, and in any situation. And if there were a situation now that calls for us to have conversations worth having, it's right now in the middle of this coronavirus pandemic. Elizabeth Warner is a physician and leader in the healthcare field. And Elizabeth, can you say a little bit about what you're seeing in your environment and how it's impacting you and your colleagues?
Sure. For the purpose of context, I just want you all to understand that I'm a primary care internist by training. So I spent the first 12 years of my career in an outpatient setting, then transitioned into some leadership roles in a mid-sized health system, working both for the primary care as the primary care medical director and then in a system leadership role. And clinically then stepped into hospitalist work, palliative care, consultative medicine in the hospital, and then doing some work in nursing homes in our post-acute division. So I think that's helpful for you guys to know that that's my perspective, that's my clinical perspective. And I currently serve as a medical director for a program for all-inclusive care for the elderly. This is a very unique hybrid and interdisciplinary program to deliver care for nursing home eligible elders, but we're still meeting their needs, or we're actually able to meet their needs in the community, either with assisted living or in their homes. And I start my comments with that contextually to understand kind of how I've always seen my role in medicine, and that my care for patients has been more longitudinal over the course of my career. What I am seeing now is also, I need to clarify, I live in Kalamazoo, Michigan, which is on the western side of Michigan. If you guys have looked at any of the maps of the United States, Michigan is, I think we're number 3
Number four,
right now,
yeah.
number 4 for cases, confirmed cases of COVID-19, which is not like a top 10 list you ever want to be on, but that's where we are. But we have not yet seen the kinds of volume and intensity in the hospitals that the eastern side of the state, the Detroit side of the state, is seeing. So we are learning from everywhere around the country and around the world that has gone before us in terms of the wave of COVID infections, which is a very unique position to be in, of sort of uncertainty and kind of waiting for the storm or waiting for the wave to hit. I'm not sure which metaphor we want to choose. And managing the emotions and the uncertainty around that. So I've always said, as a leader, I can't ask anyone else to do something that I wouldn't be willing to do for myself, that I'm already doing for myself. So I need to be really honest about starting these conversations around my own internal conversations, and how that has been a lot of work that I have been doing since being a part of this organization that I'm with now, but also since COVID-19 has come to America and is washing over us. And some of those conversations internally are pretty critical. Let's just put it that way.
And are you beginning? Can you tell us a little bit about these conversations and how you've been through some of our training? How are you able to shift this to inside a conversation worth having that impacts your well-being and ability to continue to be on the front line?
Absolutely. Because I function as a medical director, I'm also leading the primary care providers, nurse practitioners, physician assistants, and physicians who are serving our participants. And so it's an interesting position of trying to understand and support them, and also have the systems and structures in place to support delivering excellent care to our patients, to our participants. And because I'm relatively new to the organization, I'm learning everything about their culture and processes and the systems that are already in place and the longevity of the people who are there and all of the uniquenesses that go into this type of PACE program and service delivery. So a lot of the conversations that start in my head are with that not so nice critic that we all seem to have in our heads. It's usually about self-judgment around I should have known something, or I didn't ask the question right, or I inadvertently said something that might have put somebody else in a position of defense or discomfort. And so my critic is on all alert right now, and that's usually very depreciative and judgmental. So I think, Jackie, to your question, how can I flip that? How can I turn that into something else? It almost always requires more than one breath. It usually takes 2 or 3 breaths. And I hear the words again, and then I say, wait, if there's something I did that I need to make amends for, do that right away. And what really just happened here? So it gives me a moment to sort of have a different perspective on, is that accurate, what you just told yourself? And then what is a way that I can ask a question to deepen my understanding and the understanding of anyone else that's around me? And I will often do that by saying, hey, I just want to check in with what I just said. How did that land for you? Or what's another way I could ask that question that I'm trying to understand this process? Or how have we been successful in delivering this care in the past? And by doing that, I also give myself permission to say, you can't know everything. I can't know everything about this organization yet. And none of us can know everything about a global pandemic that none of us have been through before. And giving ourselves that kindness and self-compassion is by far the most work that I'm doing right now, so that I can then step out and serve my teams, my primary care providers, and our participants.
Why is it so important to do that flip with your internal thinking and conversations? Why does that matter so much, especially right now?
That's a great question. And I think it really comes down to energy. So if I let the critic drive me into doing good work, usually by 2 or 3 o'clock in the afternoon, I'm exhausted and I feel, emotionally beaten, because I have been, in my own head. If I can catch it, if I can take a breath, if I can say, it'll be okay, you're doing the best you can. What's something that you're doing well right now? If I can do those, ask a different kind of question, the energy allows me to continue to step forward and serve. And I know that we have a negativity bias, like I know that intellectually. And there's nothing like a global crisis to throw us into old patterns of behavior and unreflected patterns of behavior that require those practices that we've been practicing in easier times, to now saying, I've got to apply kindness. I've got to apply reflection. I've got to take a breath to rebalance. One of the things that I do now, and I've told all of my team members about this, is when I'm washing my hands for a minimum of 20 seconds under warm water, as we are instructed to do multiple times a day, I look in the mirror and I say affirmations. So I say, you're doing just fine. You are enough. You and your team will get through this. You have strengths you can rely on, whatever those affirmations that come into my head.
Yeah.
But I make sure I say at least 7 of them, because I'm sure that about 100 negative thoughts have happened between the last time I washed my hands. And then I smile at myself, like, okay, I'm going to fake it till I make it, even with myself. And then I dry my hands and go on with the day. And I'm humbled by how energizing that simple practice is. And it's also really grounding to say, like, this is the most important thing I can be doing to limit COVID-19 right now, is really stay deliberate about the hand hygiene and the community mitigation practices that certainly Michigan is very clear and intent on.
Yeah, that's wonderful. And that practice, it goes for, as you were saying it, I thought, and that's such an easy thing to do for one another as well. That
Yeah.
when you can see somebody's really stressed out, to say, you've got this, you're doing a good job, and to smile at each other. That's such a simple thing.
And we take a lot of group breaths too. So,
Mm.
I mean, almost all of our meetings sort of start with this. Let's take just a couple of deep breaths
Yeah.
and remember it in this moment, right here, right now, everything is okay.
And so the two practices that are in our book and that Elizabeth just used was generative questions. Those are questions that help you connect, strengthen your relationships, and create possibilities. And also positive framing, that's shifting the focus from what am I doing wrong to what have I done well? What's going well?
Yes, and you know, to support yourself, those of you listening and others, you continue to rise and face this pandemic every day. And Elizabeth kept talking about how she will pause, how she'll breathe, maybe take 2 or 3 deep breaths, and she's getting curious about her own inner dialogue and asking generative questions. What is working well in the challenge that she's facing, and how she and her colleagues can create more of the best, you know, to do the best with what you have and where you are right now. And, you know, positive emotions are so good for you. And I recommend you look at Barbara Fredrickson's work on, you know, what good are positive emotions. They're so good for the well-being of yourself and those you come into connection with. And remember, the world is applauding you. We are sending energy, and we're so deeply grateful for your service.
So we will be doing a series of these interviews with Elizabeth to provide you with additional ideas for how you can turn your negative conversations and ask questions in order to increase your resilience, your immunity, and your ability to really stay in this until we get to the other side. You can also download a conversation toolkit from our website, and there's a lot of information on there to support you. The website is conversationsworthhaving.today. We also have a number of YouTubes on our YouTube channel, which is just Conversations Worth Having. So thank you for listening, and we invite you to listen to our second conversation with Elizabeth by dialing into YouTube.
Thank you so much. Thank you, Elizabeth.
My pleasure.